Kodai Senga of the Mets suffered a leg injury against the Atlanta Braves on Friday night when he was running for a pop fly in the infield, and we saw him go to the ground just grabbing the back part of his calf. Now, of course, this was a concerning injury right off the bat because he's missed considerable time this season, and at the time of the injury, there was a lot of speculation as to whether or not it could have been as severe as something as a full Achilles rupture. It looks like he has had his MRI and those results are in. As of right now, they're saying that he's dealing with a high-grade calf strain and he's due to miss the remainder of the season. With today's video, we are going to look at the injury replay. We're also going to talk about the relevant anatomy for this particular injury. And finally, we'll go over that grading system of calf strains. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Nick Gallo and I'm a doctor of physical therapy. And with my channel, I take a look at sports injuries and I explain them so that they are a little bit easier to understand. I'll also go over the pertinent relevant anatomy of that injury and talk about what that person should expect when they come to rehab. If you like this sort of content and you want to see more of it, please hit that thumbs up and subscribe to the channel because I will be making more of these videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you yourself have suffered a calf strain, go ahead and comment on your experience in the comment section below. Now we see here on the injury video that as he throws the pitch, the batter is going to pop it up into the infield, and as he's going to go to try to field that pop fly, he's going to extend that left leg back, and when he does this, this is where we see him pull up and grab that portion of the calf. There are three muscles that are located in the calf. The first one is known as the gastrocnemius muscle. This is that big muscle that's located there that we often associate with as being the calf muscle. Right deep to that is a muscle known as the soleus muscle. And finally, there is a third muscle that's very small and it's known as the plantaris muscle. All three of these muscles are going to come down and they are going to come together and attach on this calcaneus bone. And this is what we know as being the Achilles tendon. Now, these three muscles are responsible for a few motions at the foot and ankle. The first one, whenever those calf muscles are being contracted and they're pulling on that Achilles tendon, they're going to be doing something at the foot and ankle known as plantar flexion, where the foot is going to be pointing downward like this. And then the opposite of that is dorsiflexion, where the toes and foot are going to be pointed upward. This is where you're going to be stretching that Achilles tendon and, of course, those muscles in the calf. Now, it's important to say that because the gastrocnemius is so large, it actually is going to cross the knee joint. It's going to attach on both sides of the knee. So the gastrocnemius muscle is actually going to be involved in knee flexion, which is going to be bending the knee when that muscle is contracting. And when you are stretching that gastrocnemius muscle, that's going to also be when that knee is extended. Now, when we talk about calf strains, it's important to say that the most common muscle that's going to be strained in these calf strains is that gastrocnemius muscle. And this is because it's going to span both the ankle and the knee joints. It also has a higher density of something known as type 2 muscle fibers, which are going to be your fast twitch muscle fibers. And these are the muscle fibers that are involved in explosive, short bursts of speed movements. When somebody strains their gastrocnemius, this is usually due to an eccentric trauma where you're going to have the person's knee fully extended or fully straightened, and the person's foot and ankle is going to be in a fully dorsiflex position. So looking at the model here, that's going to be when the person's leg is completely behind them and that knee is fully straightened like this. And while that knee is fully straightened, they are going to be fully dorsiflexed at the foot because they're going to push off in an explosive manner. And as we take a look at the injury replay, this is exactly what we see in the injury video. We see that while Kodai Senga is going to come off of the mound, we see that that knee is fully extended, the foot is in dorsiflexion because he's pushing off, and when he does this, this is when he pulls up and he grabs onto that calf area. Also, the area of where he's grabbing the calf looks to be consistent with being the medial or the inside compartment of the calf, which would be consistent with a medial gastroc strain. Now, we don't know specifically what muscle is being involved in this case. However, based on the mechanism of injury and the location of where he is grabbing, it looks like it's the medial gastroc. Now let's go ahead and talk about the grading system for these calf strains. They are grades 1, 2, and 3. In a grade 1 calf strain, this is where you're getting stretching of the affected calf muscle. In a grade 2, this is where you're going to be getting partial tearing. And finally, in a grade 3, this is where you're going to be getting a full rupture of the affected muscle. In a grade 1 calf strain, you're looking at anywhere from about 1 to 3 weeks to full recovery. In a grade 2, you're looking anywhere from about 3 to 6 weeks to full recovery. And finally, in a grade 3, because you're getting a full rupture of the affected muscle, this can take anywhere from at least 3 months up to about 6 months. So a grade 3 would be consistent with a high grade calf strain. They have not said that it is a full rupture, but usually when we're talking about a high grade calf strain, this is what they are referring to. Anytime we get somebody coming into the clinic for a calf strain. Depending on the grade, we're going to essentially start them off with that method known as RICE, where R stands for rest, I stands for ice, C stands for compression, E stands for elevation. Now, when the grade is severe enough, if it's a full grade 3 and a full rupture of the muscle, sometimes rehab does not work and the person is going to require surgery. We essentially see how they do in rehab first before we start to think about any type of surgical intervention. So if I happen to hear anything regarding his time frame, and if it starts to include a surgical intervention, I'll be sure to update everybody on that. Then as the person starts to progress in physical therapy and they are having their follow-up visits and they're starting to get a lot more mobility through that foot and ankle, then we're going to start to take them through strengthening, and finally we can start to work them in sport-specific movements when they finally get cleared. Calf injuries tend to linger, and any sort of muscle injury for that matter, because it's hard to tell when a person is 100% recovered. Mets manager Carlos Mendoza basically said that this is a hard injury to put a timetable on because calf injuries can be tricky. I definitely agree with that. He said it could be anywhere from about 8 to 10 weeks before he's a big league pitcher again. This would put it along the lines of a grade 2 definitely going into a grade 3 calf strain. So we wish the best of luck for Senga moving forward. If I happen to hear any updates regarding his recovery time frame, I'll be sure to update everybody in the comment section. Also, if you happen to hear anything, please feel free to update all of us as well. Thank you so much for watching my content today. If you enjoy this sort of video, I'm going to go ahead and link another one of my playlists so that you can watch some of the injuries that I've talked about in the past. Thank you so much again for tuning in, and I'll see you next time.